I'm very delighted to be here to present for you this morning. As Nancy alluded to, I did graduate from Brown Medical School in Rhode Island. And being that I lived in Providence for 10 years, I was familiar with tick-borne illnesses, but I was not aware of what chronic Lyme disease meant, nor fibromyalgia or chronic fatigue. I always had an interest and a passion for research, so I spent some time at NIH where I was able to conduct research with health disparities, because even as a kid, I always had that question, but why do things exist? I always wanted to be those doctors that can find answers and look deeper than what's on the surface level, to try to find the answer that a person needs and to get them well. And the practice paradigm at Internal Medicine of Northern Virginia is quite unique, for it is deeply rooted in research. You know, we do a lot of evidence-based research, and we are principal investigators on several different research projects at this time. And we also complement it by using integrative and holistic forms of healing, because we feel as if when you take a multi-dimensional approach at health, that's when you can really restore a person's body back to its baseline status. You don't just jump to the healing with the disease. You don't just jump to only nutrition. You have to look at the whole picture. And at the same time, you have to make sure you're aware of what's in the literature and what's groundbreaking and what's evidence-based. Okay, and those are some of the things that I'm going to mention as I help you sift through managing and evaluating this very complex illness. You will be inundated with quite a bit of information this morning, but I don't want you to be overwhelmed. Like I tell all my patients, this is a time for hope. This is a time for optimism. You've dedicated your morning to learning more about this, so you must have some familiarity with this chronic illness. But at the same time, I want you to leave this room knowing that there are people out here who can help you, or just even knowing the signs to look for. Okay, and I also can't go forward without saying thank you to my partner, Dr. Samuel Shore, and my associate, Crystal Barnwell, from Internal Medicine of Northern Virginia, who came to support us this morning. Oh, yes, stand and wave. Okay, so next slide. So, quick overview of what I'm going to discuss. We're going to go over the history, the diagnosis, some of the clinical manifestations of not just Lyme Borrelia, but also the co-infections, the management, and the outlook. Does it really exist? Now, my first encounter with a chronic Lyme patient was in residency at Georgetown. I actually had a patient who was a landscaper who came to the residency program with a tick bite, the traditional erythema migrans rash. And my attending physician at the time said, okay, doxycycline, because that's what we studied. I gave him doxycycline. He came back about 4 weeks later and said, well, I still can't work and I'm in pain. And I remember presenting that patient to the attending, who said, well, there's something else wrong with this patient. And, you know, the patient was also uninsured because we lived in an underserved environment. And she said, he's probably drug seeking. There's no way he can be in pain, and there's something else. So I really like this cartoon, and I like to start all my presentations this way, because it's a story that so many of my patients tell me. And you know, the fact that I wasn't aware of this debilitating illness, to me, is embarrassing. But to err is to be human. And now that I am part of this journey and this mission, it's my goal to educate not only patients, but other providers. So the bad news is you have Lyme disease. But the good news, I don't believe in Lyme, so you're fine. Next slide. But Lyme disease has been around for years. Actually, the 5,300-year-old ice mummy, dubbed Otzi, was one of the first where they found actually Borrelia was cultured and evidence of arthritis. Now, this here is a quick overview of the reservoir host. After hatching from the egg, the larvae in stage 1 latches and feeds onto the blood of the rodents, the white-tailed mouse here. And the next stage, during the late spring, the larvae fall off and they lay dormant in that nymphal phase. And in stage 3, that's when the nymphal activity takes place. And that's usually in the early spring, late spring, summertime, and that's when we have Lyme Awareness Month, because that's when Lyme is more present. That's when the nymph is aggressively seeking its human host or deer host at that time. Next slide. And if you can see here, this is the picture of the adult and the nymphal tick, and it's about the size of a poppy seed. So you can understand why probably less than 50% of patients even recall having a tick bite or even a rash. Next slide. And this is a slide that's from 2010, and you can see that the cases of chronic Lyme disease have been increasing exponentially since 2003. One thing to note is that I sort of feel that most likely in 2005 that patients were more aware of the symptoms of what Lyme disease was and the disease in general, and started to present to their doctor's office more frequently with those chief complaints, and that could contribute to why there was a rise in this disease. And I think now the numbers are much higher, unfortunately. So what's the general clinical manifestations of chronic Lyme disease? Well, the first stage you present with the traditional erythema and migraines rash. You also have flu-like achiness. You can have some joint pain, arthralgias, and that's in the first couple of weeks. Flu-like illness, kind of non-specific symptoms. And then in stage 2, that's the early disseminated stage. That's when you have migrating joint pain, migrating, my knee hurts, doc, my elbow hurts. I even feel it, my neck pain, my shoulders, one side more than the next. You can also have Bell's palsy. You can have that in both the first or the second, or even later stages, which I will refer to you in a few slides a little later, but that's facial paralysis. It's almost stroke-like features, okay? General malaise, doctor, I'm tired, I can't stay awake, you know, I'm at work and I have to leave in the middle of the day. I'm just very confused. And then when it's third or late chronic Lyme disease, that's when you start to see more of the neurological manifestations of this disease, the kind of Alzheimer's symptoms or brain fog. You start having the lower extremity paralysis or difficulty with word finding. Those are some of the late stages, and it mimics because Lyme is the great imitator, it does mimic other illnesses like ALS or Alzheimer's disease or multiple sclerosis. So I commonly find that patients that present to me in their late stages have been through numerous doctors and a lot of times are misdiagnosed or treated for another illness and have not healed because the infectious piece has not been addressed. Now, we think traditionally erythema, the bullseye, but this just goes to show that you can have several different and even more alternative presentations of this rash. This one here is a disseminated lesion. This one is a blistering form, uniformly red lesions, kind of blue-red lesions here. Next slide. And this is an atypical dermatological manifestation of Lyme disease, and it's a big word at the top, and it says acrodermatitis chronica atropicans rash. And even in the medical community, no one wants to use that word, so we call it ACA, okay? And it's kind of this inflammatory stage with bluish or reddish discolorization. And as it progresses, you can see here the tissue becomes kind of wrinkled, and it can also become atrophic. And some patients can have like non-healing ulcers. Next page. And this is the Bell's palsy I alluded to earlier. As you can see, the facial paralysis usually has a facial droop, okay? And like I stated, a lot of times, I remember when I was on an inpatient, I thought a patient did have a stroke because they had the same clinical presentation. So it has a similar features, but as I alluded to, it is facial paralysis. Now, IDSA guidelines. The Infectious Disease Society of America, that's the organization you may be aware of that publishes the national guidelines for infectious disease. In our training, we are taught that this is the law. You know, we follow these recommendations in order to more effectively treat our patients who suffer for infectious diseases. And what they recommend as of 2006 for actually the criteria for chronic or for Lyme disease diagnosis is that the person should live in an endemic area, have a positive tick bite, a positive serology, which is a laboratory test using CDC criteria, and I'm going to refer to what that criteria is in a minute. They need to have the bullseye rash. The tick should be attached for 36 hours, but we also know that there's evidence of transmission less than 24 hours or even 12 hours after attachment. And that treatment with doxycycline or amoxicillin for 10 to 28 days is sufficient. And if that doesn't work, there's no such thing as chronic Lyme disease, but it's called post-Lyme symptoms. The International Lyme Association Disease Society, of which I'm a member of, we're a group of multidisciplinary physicians from around the world. We actually know and understand that, yes, chronic Lyme does in fact exist, that it is a clinical diagnosis, meaning as your physician, I must take the time to listen to you, your entire story, all of your symptoms, and then make a determination of how to comprehensively evaluate you and to not miss Lyme disease as a potential etiology. The tests we know are less than 50% sensitive, both the screening and the confirmatory test, and that the treatment for Lyme disease is based on your clinical judgment, that we don't follow overall generic guidelines for treatment, but we use our clinical judgment to determine what next step you should take with your clinical management. So what are some of the generic tests? Well, the CDC or the Infectious Disease Society, they state, we know that we have the ELISA screening, which is 50 to 60% sensitive. We also have the confirmatory testing, because it's a two-tier testing of the Western blot. That doesn't include several highly specific bands, and it potentially less than 50% sensitive. There are other studies that you can have that are a little more sensitive, IGeneX testing, which looks for more sensitive band markers, that's genetic components of Borrelia, and it's a lab you can send to California. You can also do PCR and urine, blood, and there are also cultures for Lyme as well as the co-infections. Now, as you know, I did go to Brown University, and I was very delighted that in 2012, a biostatistician by the name of Alison DeLong, she published a paper which referenced that clinical antibiotic retreatment for patients with Lyme disease is warranted in some groups. And she actually initially presented this information at an IDSA review hearing where they reviewed their guidelines in 2009. And at that time, she pointed out 4 NIH studies, funded studies, that examined the efficacy of retreatment with Lyme disease. One was the Klempner trial in 2001, of which IDSA refers to for their guidelines, and she concluded that this study had inadequate statistical analysis. And the conclusion from that trial was basically that retreatment for Lyme disease was not helpful, so it didn't exist. Chronic Lyme didn't exist. And then two other studies, Crump in 2013, which showed that patients who had been treated with the IDSA or CDC recommendations of 30 days of antibiotics were not improving, and that retreatment was helpful. And the same held true for the Fallon study in 2008, where patients had worsening functioning and severe pain post-treatment. So her conclusion was that the Fallon and Crump findings indicate that retreatment was in fact effective in certain subpopulations. So you have to really call into question those IDSA recommendations. The Commonwealth of Virginia has a governor task force on Lyme disease, and in 2011, can you go forward? They concluded and acknowledged that by the CDC, Lyme disease and many related tick-borne illnesses cannot be adequately diagnosed by serology alone in many cases, and that there's no serologic test that can rule out Lyme disease. One school of thought is that patients who have flu-like illness or symptoms in the summertime, especially knowing that this area, Loudoun County, is an endemic region, is that you should think about Lyme disease until proven otherwise. Okay? The clinical diagnosis that may be supported by serology or blood tests remains the proper method for the diagnosis of Lyme and related illness. Now, in March 13th of 2013, the governor at that time, Governor Bob McDonnell, signed into legislation the Lyme Disease Disclosure Act. And what that act stated was that a patient who had been tested for Lyme disease, if those tests were negative, that provider had to make you aware that your tests are negative. However, these tests aren't sensitive, and you can't rule out the Lyme diagnosis. That's actually legislation. So if you have been tested in this area and told by your provider that you don't have Lyme disease based on the test results, that's actually against the law. Sorry. Now, what makes Lyme resistant? It does have several different forms. The first is the cyst form. And this is the dormant form, and this is a cyst right here, where it produces an extracellular kind of protein matrix, and it remains dormant or inactive in this body. And it's a protective barrier that allows for this infection to remain resistant. I always use the analogy, it kind of hides out in kind of a protective capsule when you're exposed to treatment, antibiotics, or herbals. And when you remove that when you change that hostile environment to one that is more favorable, then it changes back to its spirochetal or active form. Another form is the biofilm form. And this is where you have microcolonies, so groups of bacteria that protect themselves with this extracellular protein matrix. And that helps to facilitate persistent infection. And it also allows for the bacteria to remain dormant, but also increase resistance because the treatment will be unable to reach. And it will also be more resistant to your body's immune system in either that biofilm or cyst form. Another point to mention is that Lyme causes a decrease in your immunity. by causing it's been shown in the literature that patients with Lyme disease have a decrease in a subset of cells called CD57. Now that is natural killer cells, or the cells that naturally fight off infection. And it was published that chronic Lyme patients, they compared to other autoimmune diseases, including HIV, that subset was only shown to be low in chronic Lyme. Now, co-infections. This tick-borne illness can carry multiple different infections. The first one you have here is Babesia. Now, Babesia is a parasite. Some of its hallmark symptoms are sweats, air hunger, difficulty breathing, shortness of breath. And when I say sweats, I refer to daytime, nighttime sweats, chills. Bartonella. Bartonella is a bacteria that can enter the blood-brain barrier, and we think is responsible for some of the neurological manifestations of this disease. Patients typically report pains on the soles of their feet. Dr. Cornish, I stood up and it felt like I was stepping on ice or walking over coals. It's just really painful. Or they have word recognition or word finding difficulty or brain fog. I'm not sure if you've ever heard of that term, okay? They can also have enlarged lymph nodes, and that's a sign that's present in all of the tick-borne illnesses. Ehrlichia. That co-infection is associated with elevated liver enzymes, but you can also have arthralgias, joint pain, muscle pain. Rocky Mountain spotted fever, sudden fever and rash located on palms and soles. And mycoplasma, fatigue, cognitive impairment, musculoskeletal symptoms. Now this here is a picture of the Bartonella rash called striae, and it's serpiginous or snake-like kind of lesions that look like stretch marks, but they're not stretch marks at all. In fact, there are some that believe that these are actually development of new blood vessels, and you can see they're located anywhere, but I commonly see them on torsos and backs. Arms as well, but they can be located anywhere in the body.
Do they ever go away?
Yeah, they do. I've seen them go away quite often with treatment. But it's a chronic, just like with this disease in general, it's a chronic relapsing course. So it can resolve as you treat the underlying disease or return in times of relapse or severe Herxheimer, but it is intermittent, it's not permanent. My partner, Dr. Shore, published a paper in 2011 where he he reviewed over 200 patients in our practice who had fit the criteria for chronic fatigue syndrome. But he had a very high clinical suspicion that, in fact, these patients did have chronic Lyme disease. So he drew serology, and the patients were what we term as seronegative, meaning negative testing but positive clinically for the diagnosis of Lyme disease. So he empirically treated them with formal antibiotics. And out of those 209 patients, 88% of them improved. So we were able to draw the conclusion that there is an association with chronic fatigue and Lyme disease. Not to say that every person who meets criteria for chronic fatigue has Lyme disease, but it should be considered on your differential diagnosis. And this here is the chronic fatigue paradigm, which is what we use in our practice to further evaluate the multisystemic nature of this disease. And I'm going to walk through it with you. You first have the exposure here. It can be Borrelia or any of the co-infections. And it causes what's called mitochondrial dysfunction. Now the mitochondria, that's the part of the cell responsible for energy. So when you have mitochondrial dysfunction, you're going to have a low energy state or be tired. Then the immune system, you can have immunodeficiency, and I alluded to that earlier when I referenced the CD57. Cardiovascular system, Marjorie mentioned earlier the word POTS, which is an inappropriate change in your blood pressure from lying to standing. That's a severe form of orthostatic intolerance and has been published to be associated with Lyme disease. We actually collaborate with a cardiologist in the area, and sometimes that can be his patient's chief complaint, and then he encourages them to have further evaluation for possibly a Lyme disease involvement. Neurological signs. Lyme affects both the central and the peripheral nervous system. I was a neuroscience major, so I'm very aware of the nervous system, but not quite aware of all the entire impact that Lyme can have. Pain. You can have pain with or without fibromyalgia. Sleep. Problems with sleeping. A chronic non-restorative sleep. Psychiatric manifestations of Lyme disease, and we're going to go in more detail about that a little later. And the endocrine, or the part of the body that's responsible for signaling all of your hormones. So how do you manage this disease? And thinking outside the box is important because it's going to take more than just pharmaceuticals. It's going to require that you implement lifestyle changes, holistic integrative strategies, formal antimicrobials, and other pharmaceuticals. So we look at it from a comprehensive healing approach, where we utilize pharmaceuticals, and those are your prescription drugs, your supportive agents. You want to make sure you use your antibiotics, the formal forms of therapy. Herbals, which are your plant-based medicine, the Cowden protocol, and other botanicals that we have that can treat the underlying infectious disease. Homeopathic. Now, homeopathy is different from herbals in that it's highly diluted molecules that trigger your own body to mount an immune response. So if you think about it intuitively, similar to when you have desensitization with allergy shots, where you're putting in a low dose of an allergen to stimulate your body to fight off the offending agent, or vaccination, where you're putting a very low dose of a substance that in high dose could actually cause an adverse reaction, but in highly diluted amounts can actually be preventative. And lifestyle changes, and we're going to speak quite a bit about this as well. The mechanical intervention, the chiropractor. We're going to speak about nutritional changes, and I'm going to end this presentation discussing hyperbaric oxygen therapy. And I've provided bags for everyone, so you should have wonderful bracelets, 24 karat gold, that refer to our office, our HBOT Center, as well as traumatic brain injury. Lyme Disease Awareness Month is right upon us, so these are your gifts for you this morning. You also have in that bag a brochure on our hyperbaric center. So let's go through the different steps of healing. The first step of healing is what's called neuroendocrine support. Neuro means brain, endocrine means hormones. So you have to make sure you support that system first. The misconception that a lot of patients and even providers have is that you can just jump to the fourth step, the elimination of the causative factors. Doctor, treat my Lyme right now. That's all. Give me my antibiotics. Someone referred to that earlier, Rhonda, and I'm done. That's it. Give me a month, and no. You have to go through all the different stages. So we're going to discuss a little on neurology, your adrenal glands, your body stress response, and your mood. Now, sleep. Sleep is essential because if our body isn't sleeping, then our bodies aren't healing. So it's imperative that we have at least 7 to 8 hours of sleep now in order to boost our immune system and to heal and decrease our inflammation. So you want to make sure you evaluate and treat the problems that can contribute to fractured sleep. Is there a pain component? And if there is a pain component, you have to take care of that. Does this person have sleep apnea, which is a problem with breathing during sleeping? If that's an issue, you must correct it. Do you have mood instability? Is there a depression or anxiety component? That also needs to be addressed, as well as improvement of sleep hygiene. And when I say that to my patients, Dr. Cornish, what do you mean? Well, if you're not sleeping, have you tried turning your television off at night? Have you tried going to bed at the same time every evening? Have you tried removing the electronics out of your bedroom? Things that can help make your evening nice and serene and peaceful, maybe baths before bedtime or tea to just calm you before going to bed. Next slide. Delta sleep and Lyme disease. We know that chronic fatigue is very prevalent in Lyme disease. I alluded to that earlier. And if patients aren't going into a deep delta sleep, as I previously stated, then your body won't heal. Okay, so increasing delta sleep is really therapeutic. Pain control. We're still under the neuroendocrine support portion of the healthy template. So you can use several different modalities for pain control. You can use pharmaceuticals, which are prescription medications. You can also use over-the-counter forms of pain management, topical pain medication, holistic approaches. There are herbals like turmeric that are natural anti-inflammatories that you can use. You can alter your diet to make it one that's low in inflammation. Mechanical intervention, that's very important. When my patients ask me, well, Dr. Cornish, how much exercise should I do? I tell them in moderation, because there is a such thing as post-exertional fatigue, where you can really push your body when you suffer from chronic illness and try to work out, and then you'll pay for it later because you will wipe out your energy reserve. So I usually say 10 minutes of weight bearing or something, anything with moderation and to be cautious. But acupuncture is helpful, physical therapy, chiropractor, massage therapy, and even stretching. The nervous system involvement. So we have the central nervous system, which is our brain and spinal cord, and then the peripheral nervous system, which transmits the information from the central nervous system. And that autonomic nervous system, that's where you have the problems with the blood pressure, that dysautonomia, or an autonomic nervous system that's dysfunctional. Psychiatric manifestations of Lyme disease. It's been published by Dr. Bransfield, Fallons, and others that there is a psychiatric component to this illness. Now, you may say, well, I have Lyme disease. My daily life is impaired. I'm not functioning. I may not be working. So, of course, my mood could be altered. But there is also a decrease in the production of one of the neuroprotected acids that you produce that improve your mood. So instead of your body producing what's called serotonin, which is a neurotransmitter that's responsible for mood stability, you actually produce more of a potentially neurotoxic acid called quinolytic acid, and that has been published in the literature to be higher in patients with Borrelia. And that quinolytic acid can cause aggression or rage. We term it Lyme rage, or anxiety. okay? All of those things can be as a result of the biological manifestations of this disease and this quinolytic acid production. So you want to make sure you treat that. You know, the Meyer Clinic, they provide therapeutic services, and I thank you for offering that to patients in our community, because it's imperative that you find someone who's sensitive to your needs and you know that you're not alone. You know, you have this disease, but you can also have other reasons for feeling sad or feeling depressed or feeling angry. And the treatment of Lyme disease in and of itself can be a frustrating journey, okay? But seek the help you might need. Seek that support, even if it's a guidance of a counselor or a family member, herbals, biofeedback, whatever it is, because mood instability is a stressor on the body, and it can prevent your body from healing. The endocrine system. Now, the endocrine system is the hormonal system, all the hormones in your body. The thyroid gland, the sex hormones, the adrenal gland. You may have even heard the term adrenal fatigue, meaning the part of your body that's responsible for signaling all your hormones and metabolism can be dysfunctional in chronic illness, not just in Lyme disease, but in any chronic illness. So it's imperative that you have a provider that is researching your hormones or testing them regularly, and that if they are not balanced, that you've had replacement. But you need to be sure that that component of your health is addressed and treated if necessary. Now we're at only the second stage of healthy maintenance, and that's stage 2, which is digestive support. I want to express the importance of gut health and healthy gut maintenance. So 80% of our immune cells are stimulated from our gut, 80%. And you normally have this functional barrier around the endothelial cells in your gut that protect you from the bad things entering. Because we have normal commensal bacteria that lives harmoniously in our bodies. But it doesn't become pathogenic until we have other things that interrupt our normal gut flora. And that can be medications, that can be poor diet, that can be stress, that can be yeast overgrowth. But all of those things can interrupt that gut flora and cause what's called gut dysbiosis. And when that happens, as you can see here, that once functional barrier that you had is now destroyed. So toxins and bacteria and yeast can all leak in, and that's when you start having more of your inflammatory markers being produced. You start having problems with malabsorption or things, leaky gut syndrome. So treating your gut is very important, and that you replace your good gut bacteria with a good probiotics, even those who aren't on medications, because the stimulation of good gut flora is essential for a strong immune system. So you want to make sure you remove unhealthy bacteria. Consider eating things that are organic or pesticide-free. There are studies you can do. The CDSA stool test is one where you can evaluate your actual enzymes and test your gut for yeast overgrowth or a pathogenic or bad bacteria overgrowth in your gut, which a lot of times in a lot of my patients who have chronic bloating or malabsorption, they have that, we draw that test, and it does help us focus and target our treatment to what it is that's causing them their discomfort. You want to replace the good gut bacteria with both probiotics and prebiotics. You want to regulate your bowel function. My patients tease me all the time because I ask at every visit, well, how often are you having bowel movements? Are you going every day? And I have some patients who email me, okay, Dr. Cornish, I finally went after 3 days. Well, it's essential that we go every single day, everyone, because you want to evacuate and remove all those toxins that we've been exposed to throughout the day. So that's very important that the bowel function is regulated, and that I alluded to removing your toxins for foods, from your toxins from your food, and even consider evaluation for food allergies or gluten sensitivity. And you want to make sure you've had your nutritional deficiencies tested and treated. Now, stage 3. Stage 3 to me should almost be stage 1, because that's the detoxification stage. That's when you really try to get your body back to its normal state and restore health. We're all toxic. You know, the air we're breathing right now is toxic. The food we eat, the water we drink. But the goal is to clear them and to clear them out your body effectively. And you also want to make sure you evaluate other things, not just Lyme disease, but other potential environmental causes for toxicity that could potentially impact your clinical course and may even prolong your clinical course. And you also, when you have biotoxin illness, you can have higher levels of inflammation. So you want to make sure that you reduce those levels. Now, toxin overload. In majority of my patients, I'm starting to notice that there's more than just Lyme disease that is causing their symptoms. And a lot of times, the toxins that we're exposed to is what's perpetuating this underlying disease. So sure, there's an infectious process. However, you also have this kind of toxic milieu of where that disease is residing, from either having a poor gut or poor dietary habits or other toxins that you've been exposed to. And some people just have problems with removing those toxins out their body. So it's not necessarily that only treating that infection is what's going to get you better, but it's evaluating your body's natural state in that toxin, removing that toxic burden that's going to improve your symptoms. So you must try to find a balance between treating the underlying disease and treating the toxic burden. You have to do them together, because if you just purely treat the disease, the person's not going to get better and they will relapse. So this here is a paradigm from Dr. Richie Shoemaker, which shows the biotoxin pathway. We know that you can get toxins from everything, from water, from bug bites, from Lyme disease, but most people remove the toxins here. But some people, either because they have a genetic predisposition for biotoxicity or a chronic illness that impairs them, their toxic load just shoots through the roof. And they release these inflammatory markers that continue to perpetuate this toxic illness. And what can happen, if you go to the next page, two of the genetic causes, HLA-DR, and 25% of the population has a predisposition with the inability to remove toxins. And you can also have what's called the MTHFR mutation, which is an inability for your body to what's called methylate folic acid. And as a result, folic acid will not enter the cells. And that can cause problems with DNA synthesis and also glutathione production, which is one of our body's natural free radical scavengers. Heavy metal toxin, that's another burden that plagues chronic illness. And it is implicated in a variety of illnesses. Heavy metals can become extremely toxic, and they can remain dormant because we all may have had some sort of heavy metal exposure, but it may not become you may not become symptomatic until you have another stressor on your body that moves those heavy metal symptoms to the foreground. And potential sources: seafood, contaminated water, paint, soil and dust, amalgams from mold. And you can do 24-hour testing for heavy metals. So what are some of the results of heavy metal toxicity? Lead toxicity can lead to neurological disorders, cognitive impairment, brain fog. You can also have joint pain, muscle pain. Mercury toxicity, central nervous system involvement as well, brain fog, headaches. Also, it's been published that patients with mercury toxicity can have mood instability. Arsenic toxicity. You may say, wait, arsenic? But arsenic is found in quite a bit of our seafoods. And you can have increased thirst. You can also have what's called hemolysis, or lysing of your red blood cells. It can be extremely severe and lead to renal failure, abdominal pain, seizures, fatigue. Now, how do you get rid of these toxins? And that's detoxification is quite an arduous task, because it requires you to make quite a few changes to your body and to your lifestyle. But you can do digestive support by eliminating the toxins from your diet, anti-inflammatories. Low gluten and low yeast are really good diets. Not everyone will benefit from a gluten-free lifestyle, but gluten sensitivity in and of itself is an autoimmune, meaning your body attacks itself, and the same holds true for Lyme disease. So people may find that by removing gluten from your food, you may have an improvement in your symptoms. Green smoothies. I really enjoy green smoothies. That's just a combination of green leafy vegetables and fruits that are low in sugar. That will really be effective at helping to filter your liver and your kidneys. Now, you can make that in the blender, things like kale or spinach and a pear, a green apple. Kids love it. You'll love it. Takes a few minutes and you can go about your day. My husband's nodding in the audience because he makes me one almost every morning, so, except this morning, but, you know. Herbals. There are many plant-based detoxification strategies, one of which King Chlorella, parsley, and then the Cowden protocol. Dr. Cowden is a physician that has developed an entire herbal protocol for treatment of Lyme disease as well as toxicity. But there are numerous other herbals that I could list. Chelating agents. So you want to actually find a way to bind those toxins in your gut. And agents you can use, agents like activated charcoal, or more aggressive agents that we use in our practice depending on a patient's biotoxin load, can be agents cholestyramine or Welchol, which are traditionally known to treat cholesterol, but they also help to bind toxins in the gut. And Chelax. Chelax is a DMSA derivative that binds heavy metals. Stress reduction. That you remove your toxins that way. So stress reduction is huge. Mood stability, relaxation techniques. Physical therapy. One easy thing you can do to help release toxins out of your pores: Epsom salt baths. Nice warm bath with half a cup of Epsom salt, a little bit of baking soda. You're cleansing, you're detoxing. Acupuncturists, as I alluded to earlier, there are also special massages that you can have that will help to filter the kidneys out of your lymph nodes, the lymphatic drainage. Also, some providers, I'm not one, but some in the area, they do provide craniosacral massages, which are helpful for detoxification. If you do have that genetic mutation that I alluded to earlier, that MTHFR, you can take specially formulated folic acid to help with chelation and detox, and other nutrients, glutathione N-acetylcholine, alpha-lipoic acid, vitamin C, fish oil, milk thistle, just to name a few, but the list is endless. I just wanted to take time to pinpoint quite a few of the things that can be helpful, and I hope that you do take notes and consider utilizing some of these easier natural strategies. Now, what is glutathione? Glutathione is an antioxidant and a free radical scavenger. I tell my patients that it's almost like your body's Pac-Man. It goes throughout your body to find the toxins, to eat them up, and to remove them. And it is decreased when you have some genetic mutations like MTHFR, and low levels can be associated with dementia, to biotoxicity, to low immune system, to digestive problems, and also to central nervous system toxicity. Now we're at stage 4. So you see all the different steps it took in order for us to prepare to now aggressively treat the underlying disease. All right, so the first thing we're going to discuss is antimicrobials, and then that's antibiotics or herbals. And as I stated in the beginning, there are no guidelines for Lyme management. The best thing to do is to use your clinical judgment and to treat with antibiotics carefully and cautiously until you feel a patient is stable enough to transition them to a more holistic or natural approach. Not all of my patients start with formal therapy. They may be unable to tolerate antibiotics for numerous different reasons. Could be problems with digestion or numerous allergies, but that's why I state you have to be very careful and selective with using your antibiotics. The type of antibiotics you can use, intracellular, which are tetracyclines like doxycycline, macrolides, quinolones. You can treat that cyst form I referred to earlier with agents Tindamax and Flagyl. You can treat the cell wall form with penicillins and cephalosporins like Omnicef, Septin. And then you reserve parenterals in late stages of Lyme disease when patients aren't responding to other forms of therapy, because parenterals or IVs cross the blood-brain barrier more effectively. Now here's some of the herbal treatments for Lyme disease. And like I said, I'm giving you a few examples. There are numerous other herbals out there. But for Borrelia, you can use agents from the Cowden protocol, Cemento and Banderol, agents from Research Nutritionals, Lyme Plus, Kina and Cumanda, which are also from the Cowden protocol. For Bartonella, and Bartonella was the agent that provided the neurological manifestations of this disease, agents like BLT from Research Nutritionals, Abart, Hatunia. Babesia, the parasite with the sweats, you can use herbals Crypto Plus, ABAB, Artemisinin, Cetacuta, Anulia, and more from Cowden. Do not start any antimicrobial management without the guidance of a well-trained physician. That's very important, because just like with any medication or any treatment, there can be potential side effects or risk or Herxheimer symptoms. So you need to choose guided treatment management that you've discussed in detail with your provider. I know a lot of times my patients come and they know, I've heard so-and-so herbal works. I heard, okay, let me perform my due diligence and give you some research to support utilizing that form of therapy. But please don't go online if you haven't been prescribed therapy from your provider or you haven't sought the help of a Lyme literate physician. What is that Herxheimer reaction? That's when Lyme patients a lot of times say, I feel worse before I feel better. After exposure to treatment, depending on a patient's toxic load, you can have worsening or flaring of your Lyme symptoms on medication. That's the Herxheimer. That's just your body responding to dead bacteria and toxins in your bloodstream, okay? The misconception is that you must have a Herxheimer in order for you to know that this is working. That's not true. Remember, I said the Herxheimer response is toxicity. It helps us because we know that, yes, you're having a clinical response, but the goal of any treatment program is remission. And to achieve remission by using as minimal medical recommendations or interventions as necessary in order for you to achieve your normal quality of life. So if you're going through a treatment protocol and you're not having that Herxheimer response, you have to ask yourself, well, am I feeling better? Because that's the key. Are you feeling better once your therapy has ended? Are you feeling better when you allow your body back at its normal baseline status? When you are appreciating this Herxheimer symptoms, the best treatment, in some patients it may require, taking a break off therapy to kind of let the body cool down and release those toxins, or prepare more aggressive detoxification strategies in order to help their bodies more effectively handle those toxins that are being produced by the disease and the dead bacteria. You can go. Fungi. I need to make sure I mention this because yeast, mycotoxins, fungi, that whole family, they can also cause clinical symptoms, and they can also be systemic. And yeast lives naturally in our intestine and lives harmonious with good bacteria, and it's not until things change your normal flora, may it be biotoxins or antibiotic use or high sugar or yeast in your foods, that yeast becomes pathogenic. And when it grows out of proportion to your body's natural flora, you don't have that healthy relationship, and that's when it causes the havoc and wreaks the havoc. And it's actually been published that mycotoxins that mycotoxins that are produced by mold have been associated with chronic fatigue. And Richie Shoemaker also wrote a paper that stated that mycotoxins produced by molds in water-damaged buildings can cause prolonged illness. And a lot of my patients who may be teachers, I noticed a pattern in some of my patients. I actually have a small sample size of patients who are teachers, and they would go back and feel terrible once the school year started. And in the summer, they would feel better. And it wasn't until we really got down to the root of it and we did biotoxin analysis and changed their diet and lifestyle strategies and further investigation, okay, where are you working? I'm in a basement at my school. It smells musty. Or my bedroom's in the basement. We just had a recent flood in my house and I feel worse at home. Those kind of questions need to be answered because the environment is key. That's kind of the key in treating chronic illness. So those are questions we ask all of our patients. Is your basement musty? Do you work in a basement? What kind of environment do you live? One patient told me they were exposed to musty records, or, they tested their house and they found that mold was all in their bathroom, and they put the right filter and remediation system in place and got better. And it's not that necessarily that exposure, that fungi, that mycotoxin was the primary cause, but as I explained earlier, it can perpetuate toxin release. just like with Lyme disease. So it may not be an exposure that you have at that time, but if your body is unable to clear itself of toxins, and then you throw another toxic environment on top of that, you're dealing with chronic illness, you're dealing with your Lyme disease, you're treating your poor diet, and then you have another environmental illness, you're going to be really challenged. So some of the clinical manifestations of fungi, orally you can have what's called thrush, which is kind of thick, like pasty appearance of the tongue. People can have sores on their mouth. You can have inflammation at the corners of your lips. Skin and nails, you can have red rashes with satellite lesions. Neurologic, there are neurological manifestations of fungi as well, with headaches. You can have depression, brain fog. Fungi can also contribute to joint pain or muscle pain. A lot of GI issues, bloating, malabsorption, irritable bowel, and then nasal symptoms, chronic sinusitis, chronic allergies. And you want to make sure you treat that infection as well. So for the biofilm form of Lyme as well as mycotoxins, you can use natural enzymes, proteolytic enzymes that break up protein, fibrinolytic enzymes that deplete fibrin, and then a protocol, lactoferrin and xylitol, which naturally help remove that extracellular protein matrix and open the biofilm. For yeast, making sure you have low yeast diet. There are herbals and homeopathic agents that treat yeast, as well as the probiotic that I mentioned earlier, and then boosting your immune system. Now, we're going to end this discussion about talking about hyperbaric oxygen therapy. And what that is, we have a center at our practice where we have a monoplace therapy, a monoplace chamber. And that's a therapeutic intervention which we treat patients with 100% oxygen under various degrees of depth of pressure and create environment of hyper or high levels of oxygen. Now the terms for our ATA, or atmospheric pressure. So 1 ATA is sea level, and 3 ATA is the equivalent of 66 feet below sea level. So you're not actually diving under sea level, but it feels like you are. And our chambers actually go down to the depth of 3 ATA. Now this just gives you an example of the arterial oxygen tension. When you're at room air, or 1 ATA, you're 100% for all argument's sake. When you go into HBOT at 100% oxygen, your arterial tension increases 6-fold. When you go to 2 ATA, it goes up 14-fold. And when you go to 3 ATA, 22-fold. So some of the FDA-approved indications for hyperbaric oxygen treatment are wound healing, carbon monoxide poisoning, arterial insufficiency, necrotizing soft tissue infections. But we treat a lot of the non-FDA indications for hyperbaric, which includes chronic, and they are all evidence-based. So when we're presenting hyperbarics to any of our patients, we make sure that we give you the evidence-based journal articles that reference your particular area of interest. So fibromyalgia, Parkinson's disease, cerebral palsy, Lyme disease, GI issues such as Crohn's or inflammatory bowel disease, sudden hearing loss. Now, how does oxygen work? Well, it works by over 5,700 different ways. You're going to have upregulation of growth factors. You're going to have reduction in edema or swelling. You're going to have promotion of new neuron pathways or new nerve cells. You're going to activate sleeping neurons. So it helps us to understand that the nervous system is more plastic than we once were thought to believe, and that you can actually generate new nerve cells. Now, a dead nerve cell, once it's dead, but the actual ability to generate new nerve cells is why we think that our patients with Alzheimer's or cognitive impairment, traumatic brain injury, one of the reasons why they improve with this technology. It increases ATP with regulation, which is responsible for energy, and it downregulates inflammation. Some of the other benefits of hyperbarics. You have the development of new blood vessels. So areas that may have been ischemic secondary to an infarct of some type or a stroke, you now have increased perfusion because you generate new blood vessels. You also, as I alluded to, have new nerve cell development. You're able to have immunomodulating abilities, or the ability to improve your immune system. It actually shows that one of the enzymes HBOT works, helps to produce is glutathione. And I referred to glutathione earlier in my presentation and let you know that it's a free radical scavenger and helpful for detoxification. So HBOT in and of itself can be a treatment for detoxification issues. Decreases in brain edema, and it also has been published to be helpful with mold toxicity treatments. Now, this article was published by Dr. Fife in 2000, where he looked at the benefits of hyperbaric oxygen for Lyme vasculitis. And in this case study, he had a 14-year-old who had severe crippling inflammatory arthritis, and all the pain resolved with hyperbarics. The reason that hyperbaric works on Lyme disease patients is that it has what's called bactericidal effects, meaning it kills the bacteria, okay? And when you have that happen, you're going to release the toxins and the cytokines from the dead bacteria. So sometimes patients who undergo hyperbarics can experience that Herxheimer response. So it's imperative that if you do consider incorporating this alternative off-label form of treatment with your therapy, that your whatever provider that's managing your Lyme disease at that time is aware of this fact and aware that you're pursuing this form of therapy. All right, now the final stage. We've made it to the home stretch. We've got our nerves, we've done our hormones, we fixed our gut, we fixed our toxins, we are detoxed, our mood is good, we're doing all it is that we need to do to get our body back at baseline. So how do we stay there? Because we know that this disease has a chronic relapsing course. And it's my goal, and all of our goals as providers, to obtain remission by using minimal intervention so that we don't obstruct you from your natural quality of life. So you want to always keep in mind those different lifestyle modifications we've discussed, because that's very important as we obtain healing, that your lifestyle stays pure, that you continue to remove toxins, and that you have some patients might require some sort of maintenance therapy for the underlying infectious disease. And this will all lead you to clinical stability. So I want you to make sure you leave here being able to recognize some of the symptoms, that this can, if this holds true for you, or you can help someone else that you may know, okay, who may be suffering from this illness. I want you to leave here hopeful. I don't want you to leave here frightened. I did present a lot this morning, but I want you to know that there is help in this community. There are numerous Lyme specialists that can help you through this journey. And if anything here related to you this morning, then that could be a sign that you should seek help from a Lyme literate provider. And more, I just want to congratulate you again for listening and taking your morning off to come here. And I hope that I've encouraged you. I thank you for being a wonderful audience, and losing is not an option with this disease. So let's go to win. All right.